Hello, hello, welcome. Thank you so much for joining us today as we celebrate Women's History Month, the time to honor the achievements, the contribution, and resilience of women. And we are absolutely fortunate to have such an incredible group gathered today, really inspiring crowd. And you guys bring a wealth of knowledge, experience, and I hope you will share all of this with us today. I would like to introduce our panelists. And we have Grace Russak. Grace Russak Advisory, formerly Senior Vice President and Regional Director of the Foundation and Institutional Advisors at Northern Trust. And Grace has been wonderful. She helped us navigate through such a complex structures of board, fundraising, wealth management, compliance, you name it. Thank you. Next, we have Louise McCarthy, the President and the CEO of the Community Clinic Association of Los Angeles County, or CCALAC. And if you know Louise, Louise is Jeanne d'Arc of community clinics. And if you call her, she doesn't pick up. She's most likely on a plane traveling to Washington. Mark my words. And finally, we have Dr. Tracy Robinson. And this is my personal role model and absolutely extraordinary person, woman, and professional, the CMO of Chief Medical Officer of Men's Health Foundation. Please welcome. Before we jump in and start, I would like to reach out to our guests who are watching us via Teams. Hello. Please remember that this is an interactive panel. So feel free to comment, post questions, share your thoughts, ideas. We're going to read it throughout the panel. And meanwhile, I'm here with my notepad. I'm going to take notes. I'm going to be an A+ student today, and I'm going to soak in that vibe. So I'm so excited. And the first question, how does it feel to be a woman in 2026?
What year is it? I can't tell if we're going forwards or backwards, honestly, sometimes. Interesting. I'm so glad to be a woman in Los Angeles in 2026. I'm so glad to be a woman in the health center movement in 2026. And I'm so thankful for all the progress that we've made and the sheroes who have preceded us, but also this amazing movement of new vibrant feminists who are teaching us what feminism needs to look like. So these are scary times for sure. And sometimes it feels like we are moving, not sure if it's backwards or forwards, but I don't think there's any other place I'd rather be.
So really, has it changed since the 20, 30 years ago?
Oh, dramatically. I think, in this country, when I started working, and I know we'll get to it, but it was hard. You had to be better, the drive-by pregnancy and delivery, the back to work, a lot of being talked over. While there's still a lot to be done and things haven't changed permanently, I have a very sensitive antenna and I see things. But what I really appreciate is that things are better. We have 3 daughters. They do what they want, and I love that. With the same, antenna settings. I particularly like seeing a lot of the men of their ages who are, no, I can't meet late, I've got to go home. Or there's a lot more parity in sort of the work-life balance or being part of the family or accepting that the woman might be the boss and things. So overall, it's a massive improvement, I would say.
For me, I think it's just resting and being comfortable. As a woman of 2026, my life is informed by all the years prior to 2026 and how I have grown as a human, how I show up for my family, how I show up for myself in the workplace and at home. It's just a real comfort level. And I agree with you, Louise, that what year is this? But I'm going to go on the ledge and say I feel as if we're taking steps backwards because there seems to be an attack on humanity that resonates across so many different genres. It's a little bit hard to keep up. But in 2026, I love it.
Thank you. I love this. And thank you, Grace, for mentioning that women have so many facets, sides, that you can put us in the box. When I think about myself, I feel I stuck somewhere between football player and ballerina, dreamer and realist, a witch and the princess.
All
I'm
of that.
somewhere in the middle.
You
I
say witch
love it.
like it's a bad thing.
It's a good thing.
Yeah. Balancing it all.
And tiny little pause. We would love to introduce our fourth panelist, Paulina Zamudio. And Paulina is the chief of the Division of HIV and STD programs for the LA County Department of Public Health. And Paulina has been our partner for so many years. And our organization couldn't get as far as we got without the partnership with Paulina. Thank you. We are so grateful.
Thank you. LA traffic. But yeah, I'm one of the division's chief. The director of the Division of HIV and STD programs is Mario Perez, and I worked with him for over 25 years.
Thank you.
Yeah, this partnership with Men's Health is great. We started way back and, kind of meet the needs of very specific populations in LA County. So it's been likewise a great partnership. Thanks for the invite.
Absolutely. It's a pleasure. And going back to self-resignation, how would you describe yourself?
How do you mean?
Fighter,
Oh,
philanthropist, dreamer. If you have 5 words, which one would you pick?
go with idealist, but also fighter, helper, leader, and complete slug some days.
Gosh, I want to be you when I grow up.
I think for me, I'll choose adjectives versus nouns, and just reflect on what our organizational culture is at the Clinic Association. It's integrity, service, partnership, innovation, and equity. And I will add on from myself personally, comedy, because I couldn't do any of this work if I couldn't laugh. So these are all things that are core to what we do that make it, just being mission driven, but without humor, we'd be dead to rights.
Thank you for sharing this.
I think I would describe myself as steady, determined, fierce, opinionated, but tempered with grace.
Amen.
So,
Love this.
Yeah, I like the fierce one. I think many of us don't feel that that's what we are, but it comes along with survival and resiliency. You mentioned resiliency, that all is fierce, and I think we need to acknowledge that. I also, I'm a server. It's sort of the same thing as helper, right? So I would use those.
Thank you. This is very powerful. 10 little bits of information and statistics. 94% of women in C-suite positions played sports. Around 70% of female CEOs were college athletes. 70% of women leaders say they were encouraged as children to voice their opinions. And the cherry at the top, having only sisters increases the probability of holding a leadership position in the future. So looking back at your childhood or teen years, what early experiences or influences helped shape who you are today?
I went to all girls schools, and was very much encouraged at home to speak an opinion. Ditto in the schools. I went to an all women's college, which I loved, and I joke that it wasn't until I got there that I realized what a handicap it was to be a woman, because it was sort of. But it stood me in enormous good stead. And then you get out into the working world, and all of a sudden your voice isn't quite as well received, or you learn to cope with that. And we can talk about some of that later. But I did play sports. I played crew, which required a lot of teamwork. And I think having that ability to have your voice, but be open to other people and being more collaborative, I think is, and I think it's and developing also what they call now EQ. And I think in a lot of the business and professional world, it still isn't necessarily appreciated, and it's so important. And women bring it with them, and even now, one might still have to make a case for a perspective that includes EQ, and that's surprising to me. But those perspectives and awareness sort of came through early years, school, sports, things like that.
I can see that. And you mentioned all-girls school. So was it more of a sisterhood or boot camp or both?
All girls schools, very much sisterhood, and then in college it was neither. It was just a very feminist situation, and so I sort of blithely hadn't realized how bad things were and was made aware. I joke about it. It was all very worthwhile and helpful, and stood me in good stead. So
I think for me, it started pretty early, I will say, and it started with my family. I grew up in a family that was founded in service. My mother had been a mother superior. She was a Catholic nun for 20 years. My father was a parish priest. My godmother, my mom's sister, was also a Catholic nun. And when she was left in charge of me at 2 years old, my parents came home to me pounding around with my fist up saying, "Power women." And it stuck. It stuck.
It wasn't a choice.
It
I
was.
see.
It was. It's coming out of liberation theology. It's coming out of walking the talk. But then I dabbled in sports. I actually got into martial arts in my late 20s. But in junior high, I was a butterflyer in swim. So if that just gives you a sense of
wow, that's impressive.
It's powerful.
move forward, but also theater. I loved theater. And I think that's actually, in thinking about a leadership journey, something that's helped a lot is that fake it till you make it. People say, wow, you're so confident, you're so this, you're so that. You know what? Acting. Just put it, you got to play the part. You got to go into some of these rooms and do the work. And especially if you're doing work you believe in, no matter how scared you are or intimidating certain settings can be, just having that sense of power, having that sense of swimming through as a butterflyer, not the most fun sport, and just act, just be method acting in life.
Yeah. I was doing breaststroke, so I can relate totally.
I didn't have the benefit of being an athlete, and not because I couldn't, I just didn't want to for whatever reason. I was the only child for quite some time, and my sitters, my guardians were all males. So I was, from the beginning, someone sitting at the table having conversations and making my thoughts well heard. But service for me is, I'm from the South, and not only am I from the South, but I'm from a Christian family, and service is ingrained in where you eat, breathe, talk, live. So my helps, acts of service, helps, providing for others, working with those that didn't have the benefits that I had was natural, and it was expected. It wasn't something that I was celebrated for, because it was who we were as a family, and we absolutely had to do it.
That's great. I grew up with 4 brothers and my mom. So, she was a very strong woman within the cultural constraints of a Latina. She stood her ground, and that's sort of, I learned by watching her, because, in our culture, it was very different, right? I wasn't exposed to, sort of liberation, speaking up. And so that's something I had to learn while immigrating to the US. I immigrated when I was 10 years old. So sort of being exposed to other people, sort of the different cultures, and learning how to have that voice, it kind of it helped to. I did play volleyball in high school, and of course, we played sports because my dad was a cyclist in Ecuador. I'm from Ecuador, so sports has always been, that is. But it wasn't something that sort of helped me be a leader or helped me with that journey. I think it's important just for team building. Sports kind of help that, and dealing with different your own insecurities and sort of other people's expectations and so forth. But sort of the voice that I found as through my career and through school was helping people. All right. So I started at LA City Community College, my education career, and it's that place is the UN. It's people from all over the world. It's people from all ages, and I got an opportunity to start working with them and helping people, with whatever they needed. And so, being the voice of people who didn't know how to express, their needs, that I was put in that place. And that helped me, to also find my voice and to speak up and to participate. And it takes a while for people and for my background, but we get there with the opportunities, that are kind of offered. And then you kind of have to realize the opportunities and take them.
Paulina, do you think that experience brought you to public health?
Yeah, I mean, my parents are always people that helped others, especially my mom. She was always looking out for people and always expressing, you got to help people. She always helped people. And my education career actually started as in political science because it was very interesting to me there. I dabbled in photojournalism. And through all that and serving people, I know it's a very winding road to get to public health and administration, kind of career, but that's how it went. It's like experiencing different things, and as a photojournalist, you kind of see the lens of what's going on. You're an observer, and you kind of learn to see all sides of things. People miss a lot of things. We just walk around and we don't see things. And I realized that, now I pay attention to a lot of things and people may miss certain things. When you actually have that training, you can see it, and I think all those little tidbits. I think I was, the reason I changed into political science and then public policy administration, because the photojournalism world, when I started, was male dominated. And
there you go.
And the instructor, and I was only one of two women in the photojournalism. I went to Cal State Long Beach, and it was also driven by what kind of camera you owned, right? Like everybody's using Nikon, and I have a Canon. I saved a lot of money. I mean, I worked through my whole summer to buy that Canon. I was very proud of it, and I show up to this class and you have a Canon.
Oh.
We use Nikon here. I'm like, okay, sort of that. It wasn't a fight that I wanted to fight, and that's the way I pivoted to doing more direct work.
I can see that. Thank you for sharing. Globally, only 47% of women participate in the labor force. Can you imagine? 47, compared with around 72% of men. So something tells me it's not a choice. Thinking about your own journey, what challenges or barriers did you face entering and staying in the workforce?
I never had an option to leave the workforce. I mean, being self-sustaining and left my house when I was 17, had paid for my education with, thankfully, scholarships and grants and loans. And then after I left, I don't think I stayed in my parents' home maybe a month max at two different times in my adult life. Leaving the workforce wasn't an option. I needed to pay rent. I needed to eat. So whether it was temp jobs, waited tables for 10 years, even working at nonprofits, did side hustles, anything to just keep going. So it wasn't, as a single person, there was no one else to land on. And for the last, 20 plus years here in California, for me, I am my own safety net. So that there just wasn't a choice about whether or not to be in the workforce.
Did you ladies have to give up anything to get where you are right now?
I think the two challenges were being a woman in a man's world, and trying to constantly move ahead for the same work, you'd say something in a meeting and nobody says anything, and 2 seconds later a man says exactly the same thing, and
Oh my
everybody's like,
God, all the
And
time.
everybody
Right.
applauds his.
So many
Right,
times.
and it's sort of, and when I was younger, I would just take it and not say anything. So I think navigating that and not being relegated to sort of the assistant or the junior person when you're doing the same work, it becomes a challenge. And it's a very fine line between asserting yourself and asserting yourself right out of the firm or the role or something. And then the other part of it is when you have a family, because I think that brings in pulls that are completely different. And I was lucky when our first daughter was born. 3 senior women at my firm were the same age. They each had a child a little bit before I did. And they gave me some wonderful advice. And they called me in and they said, "This is your support group." This was incredible. You will never be 100% at work or 100% at home ever again. Deal with it.
Mhm.
It's just the way it is. And don't give excuses. If you have to take your child to the pediatrician, you're going out or you're going to the doctor, don't. So it was sort of these tricks of the trade. And then my husband and I decided that as we were raising our family with 2 very demanding careers, we would just keep having conversations. Not that I would leave the workforce, but I might not take on a different role or something if the children required that. So that was the sort of balance that I don't know how many men actually face. And every woman, I remember the number of times being around a meeting and thinking, who's picking the kids up? I'm running late. What's for dinner? And every other person in the room was male who had a wife who was at home.
Right.
And they weren't even wondering about it. It was completely different. So those are sort of the 2 main challenges, I think, that I think it's a negotiation with yourself every day. And one of the things I have shared with my daughters who have children is don't plan out the perfect childcare or the perfect scenario for the next few years. It's for now, because things will change and you will deal with it and it'll be fine.
Absolutely.
But I didn't know that, so I was sort of navigating in 3 years, whatever, but you get there. It's just, I don't know that many men have those calculations going through their head.
Something you said, it really just hits, is that not having to apologize is, because I think all too often we say, sorry, I have to go do this other thing, this other responsibility. Sorry. And even when I was in martial arts, noticed that the women that were in our martial arts group would, "Oh, sorry, I took up your space. Oh, sorry, that no, the only people who say so sorry should be Canadians. That's like that's what they say sorry all the time. And we just have to ban that word from our vocab, unless and then when you do need to actually apologize for things that are real,
Right.
then it's real.
Right.
But I just love that you brought that up and that you had those women that said that.
It was
to you.
incredible, incredibly
So
helpful.
what are the hints? How to take the space in the room? How not to shrunk? Could you share? What did you do? Did you have mentors? Did you advocate for yourself?
I definitely had mentors. I know how this sounds, but I have to say it. It's not in my DNA to shrink. So it's not my genetic makeup. But what you asked before is, what did I had to give up? And my response is a bit deceptive, because what I had to give up is my reactive approach to feeling like I always had to prove myself. I just said, I'm enough. And I don't have to prove it to any of you. I don't have to apologize. I do need to be respectful. I do need to be kind. But I am my own safety net. I have to live, and this is what I need to do that. And let us work together to see how we can collaborate on a good end result.
Being authentic, unapologetically yourself.
Yeah, and that's hard, for like it's a learned thing, right? That you have to unlearn to not say sorry. Remember one of the in college, one of the professors who was a woman said, "Don't ever apologize for anything. Don't start with I'm sorry. Don't say I'm sorry I'm late." And we're like, no, but that's not. Your mind starts saying like that's so rude. But when you really look at it, a lot of powerful men they don't apologize, right? It's like I'm here. So what if I'm late? So that kind of attitude, kind of relearning that. I didn't also. It's not like I didn't have a choice. I just never thought of leaving the workforce. I don't have children. My the husband and I did not have children, but later on, I was a caregiver for my parents, and I actually, I guess what you would have given up is a childhood, probably, as an immigrant child of parents who didn't really speak English that well. I was their interpreter for everything. At 11, I was interpreting at my mother's medical visits. So losing that shyness of I couldn't afford that. I had to learn not to be shy and speak to the doctors on behalf of my mom. So it's sort of the circumstances you're placed in on how you're going to react, right? And you're going to, okay, this is what I need to do to move on, to move forward, to be heard. And I think for me, it was just that maybe because I was born with men and, and lived my whole life with men. But and what I learned from my brothers, especially, is that they were very supportive men. They wanted success for me as a woman. They knew it was harder, and they always pushed, but they never said, "No, you're a girl, you can't do it." So I think that was important for my sort of journey and the adaptation.
I totally see that. Being an immigrant kid, you have to grow up so quickly. It's not just being interpreter for your parents. You become an advocate for your parents too, because of the language barrier. Yeah.
I think what she said also is that piece of like, you don't have the option to shrink because you have a reason. When you're going into that room, you're, and maybe it's being a little sister and getting picked on, that you have to put your hands on your shoulders. No, I'm here, and you're gonna listen to me. To the person who told me to calm down, to the person who patted me on the head, to the person who put their hands on their knees and crouched to talk to me because I'm of smaller stature. I turned into a pufferfish, like the opposite of shrinking, because it was just like I knew that I had all these health centers. That was the reason I was in the room, and I couldn't let them down. So like with the parents you're translating for, the family members you're helping, it's in their service that you're not shrinking.
But then it's, I think, and I don't know if this is so much a women thing, if it's just a me thing, but I think everybody here's on the same page. You can forget about yourself because there's a bigger purpose for it. I think one of the things, to your point about what do you give up, I think one of the things I have always been terrible at is the me. My doctor's appointments, my time off, my hobbies, that gets completely lost in the interest of balancing everything else. And I wouldn't have had it any other way. I loved it, but it people say, "What's your hobby?" And I'm like, "What's a hobby?" Is there a spreadsheet for that? And it's not that I'm that technical a person, God knows. And I think the point of having supportive men makes all the difference too. We were in a situation where there was a big pitch for a big company, and the founder and CEO was there with his son and daughter and name brand, and they were selling the company, and talking to us about, wealth management, philanthropic, blah, blah, blah. And we had rehearsed this whole meeting and everybody, and I was the quarterback and it was all agreed upon. And about a quarter of the way through the meeting, I'm proceeding as agreed, and the CEO stepped in and he said, "No, you've got it all wrong," and took over the meeting. And the way he said it was so dismissive, and he wasn't normally like that, but he was so dismissive and so rude. And then he took over. And of course, I'm thinking, I'm going to cry, and that's terrible because I was just so shocked and tired. So I excused myself for a few minutes, and then I came back, and I said virtually nothing for the rest of the meeting. And at the end of the meeting, the founder, stood up, thanked us all, and he says to the CEO in front of everybody, "Next time, listen to her. She was right. You should never do that to your people," and walked out. And we did not get the deal. And then one of my male colleagues came and he said, "You can't deflate like that." I said, because the energy went out of the room. And I said, "Then you need to stand up for me.
Yeah.
You wouldn't say something to him there, but you should have helped me get my footing back and kind of taken back. So you can't put that on me." So it's these sort of conversations when you have these strong personalities. But I went home to my 3 daughters and I said, "What year are we? This is still happening." And I was almost made to cry in a
Yeah.
meeting. How ridiculous. So it's,
And as women, as a white woman, recognizing my power in those rooms to do that for women of color, for other groups who are marginalized, who need that assist to be the quarterback. I'm guessing that that's a sports term, but that to be able to, you're not shrinking, but you're elevating.
yes.
And I
Yeah.
think that's where how power in my mind has changed from the start of my career, where it's like position, the role, the title, where are you on the
Right.
org chart?
Right.
There was all these, where's the org chart? Where's the latest version of the org chart? I want to see this.
What's the
this
next
about?
thing for me to get
Yes,
to?
exactly. And now it's definitely much more relational.
Yes.
And I like one of my biggest accomplishments is the alumni who've left our organization and who are doing amazing things. It's the people who've stayed in our organization and who've moved up. It's the people that you bring with you in those relationships as opposed to the org chart.
Yeah.
Well, and there's a story in the Obama administration of the women who got together, around the cabinet, and that sort of back to the you say something and nobody says anything, and then a man says it, and they decided they were going to help each other, and so that's exactly what Tracy said 2 seconds, and sort of take it back, and that's that sort of helping one another that has to happen.
Dr. Robinson, I'm sure you can relate a lot. Being the only one Black executive in the room, being the only one woman executive in the room, being the only one Black woman executive in the room. How does it feel?
It is life for me because I've been the only one in the room for most of my 60 years. That said, though, I made the missteps, and I will say it's my misstep when I've shut down in that meeting, because at that moment, I didn't have the emotional maturity to be able to overcome my internal turmoil to communicate in a way that the point could be gotten across. So I missed some opportunities there. But then what I learned in over time is, again, what I hope every woman and every person is, you're only in that room because you deserve to be in that room. And it may be for a short time, it may be for perpetuity, but you deserve to be in that room. So you have to bring your very best self.
Yeah.
And because your wisdom, your candor, your honesty is what will propel them forward. So that's a longer answer to your question. I'll stop there.
And I love this.
So, but I think, because you started talking a little, or someone started talking about self-help, sort of knowing your limits, not having a hobby and all that. So I think it's important also to make sure that younger women understand that you don't have to learn that at 60. Like you can do it at 30, at 40. You have to put yourself first. A lot of us learned the hard way, right? A lot of us learned not to put ourselves first, causes illnesses. And then sort of life hits you in the head. It's like, what are you doing? You know, you can still be a leader, you can still have your own, but you have your own life. Like what makes you happy outside. Our work makes us happy, that otherwise we wouldn't do it. It's our life work, right? We help people. But there's also an inner, need, whatever that is,
Mhm.
right? So finding that and putting time on it, whether it's reading a book, whether it's traveling. For me, it's Zumba. I'm an instructor. I started late, but I started a class. I like dancing, and now I'm a Zumba instructor.
I'm
I
so
love
happy for
that.
you.
I love
And
that.
a good one.
An
And
excellent
And that
I'm ready to take your class for sure.
Absolutely.
that is my de-stressor every day. If I didn't have that, I would be like this, So finding that is important, and like consciously, women need to do that as early as they can.
Thank you.
Well, I think that's an important word, though, consciously, because Grace touched on it. Louise has said it. It is, in these circumstances, it is the sisterhood, the mentorship, the taking someone aside and saying, this is the way it is now, but this is the way you can navigate it. And you may not be able to do that every day, all day long, because we have competing priorities, but there is time and room for it. And if we make those efforts, it makes a real difference.
And I love this sisterhood more than mentorship somehow. It's right.
I think mentorship, people can like inflate it, to this like, I'm going to talk to this person on the mountain in the robes, and they're going to be giving me, oh, mentor, who are you? Like give me all this great advice. I'm mentored by people younger than me, by people in junior positions. I'm mentored by colleagues, by people who they don't know. I don't tell them. Maybe I'm tricking them into being mentors, but it's just that everyone you meet has the opportunity to help in some way, shape, or form.
Right.
And sometimes it's in the questions that they ask you, because they're seeking something, and just by them seeking something, that's making you think about something a little bit differently.
Right.
So I think it is, and meeting with folks who are starting their careers and ask, like, I'm looking for a mentor. You can have as many mentors as you want. There can be as many mentors as you want. Just it's open.
Like a sponge.
It's
just,
sponge it up, and they don't have to all mentor you in everything. Like someone can mentor you in emotional intelligence. Someone can mentor you in like more functional skills. It doesn't all need to be all encompassing.
There's one story very fascinating. I had a pleasure meeting retired surgeon. Her name is Susan, and she's a dear friend of Grace. Grace, would you mind sharing that story when she just started her first job
Yes.
in LA?
Yes, 1988. She was starting as a surgeon, fully fledged at Children's Hospital, and the day before she was starting, she was given an orientation tour by one of the nurses, and they got to the scrub rooms, and the nurses said, "I'm so sorry, I don't know where you're going to scrub in because the rooms say doctors, nurses." These are where they changed, scrubbed in. And my friend, we went to the same college, and she's very calm, very soft-spoken. And she said, "Don't worry, it'll be fixed by tomorrow." And her last meeting was with the CEO who'd hired her. He said, "How did it go?" She said, "Fine, there's one little change that I assume will be made by tomorrow." Explained it. And he said, "It'll say men and women tomorrow," which
Love
it
it.
did. But
love
I
it.
remember thinking, oh my God, the challenges some of the professions have.
Mhm.
And I was just stunned that she was the first woman surgeon in 1988. It's
Somebody
crazy.
need to pave the way.
Yep.
Ladies, how do you see women influencing the future of healthcare, and where is there still work to be done?
I think a woman has to be in the room. I think our superpower is we are able to see globally, but not overlook the details, the disenfranchised, the vulnerable, to anticipate, which is not to say that others cannot, but to anticipate the challenges from the perspective that is uniquely ours as women.
Mm-hmm.
So any vision for healthcare progressing to be equitable, safe, high quality has to have a woman in the room. Not can, has to have a woman in the room.
Absolutely. I couldn't agree more. Or you-
Yeah, I agree with that. I mean, I think healthcare cannot progress or improve without a woman's voice. And so we have to make sure that the woman's voice is there. And that's part of like our continuous work, right? Because we're not going to be there till we're 100. I'm not anyway.
No, you will be.
Zumbaing at 99.
I was Zumba, but maybe not. Going to the corporate that work at the departments. But it's just making sure that young women know that, right? That they're needed and that their voices are needed, and that healthcare is as tough as it is now, because that's a challenge now, isn't it? That a lot of people are leaving healthcare, and a lot of women with they have priorities. They have to take care of kids. They have to take care of themselves. So they have to see a career that can help them survive. And if you're faced with, okay, I'm going to have a job today and not tomorrow, that doesn't help, right? So, but just making sure that there's safe spaces for women to continue in healthcare.
I think for me, because I'm not in healthcare per se, so I think it's sort of two parallel or maybe the same sort of things to consider. One is women in the workforce in general. How often, for so long, a woman's perspective has been viewed as either emotional or unimportant, or let's just talk facts, or this or that. And that EQ that so many women bring to the table, it doesn't mean they're less intelligent or they're less aware of the facts or that their reasoning is any different. They're just adding a different dimension that, because so many men don't have in the same way, they view as just wrong or unimportant, or they don't even see it as relevant. And I think that's one of the things that really affects women in the workforce in whatever field. You add to that the healthcare and the fact that women's health is under attack, and it has always been secondary, and it's always been, well, you can always juggle or this or, and obviously we're seeing, in DC, so many issues going on right now. So I think it's perhaps the most important area for women to be involved in, to both advocate for content and approach. And I think that's more than any other field I can think of.
There's that saying, if you want to go fast, go alone. If you want to go far, go together. And I think that's what you see
Beautiful.
with women in leadership, when we do harness our true potential and we're not getting sucked into the power dynamics that folks like it's transactional and needs to be one over the other. I love that you had an example of a surgeon in the 80s, because still to this day, we see that women are more common in primary care than in the hospitals. When we look at leadership of the payer organizations, who's in charge in the C-suite of the managed care organizations, of the hospital systems. A lot of progress has been made, and we've got a long way to go. So I think making sure that folks see that that's an opportunity that's available, that's a room that they should, to your point, Tracy, that they deserve to be in, and that the professions shouldn't be gendered in the sense of, oh, this is the more of the primary care is this, specialty care is that, hospital care is this. Oh, who's good with finances? We're good with finances. You're a financial advisor, So I think just really thinking through how do we, and over generations, it's been great to see how that's changed over time. Because when I was coming up, the folks, the feminists before me, had lived in the world where they had to act like men to get ahead, and to what they perceived to be, the shoulder pads, the elbows out, just get right, move forward. Whereas we were kind of into the more like, yeah, we need to be more ourselves, and we can be funny, we can be this. But then when the Me Too movement happened, and I saw what was coming in the generation after us, I was like, it's so unapologetic. It's I can dress how I dress, and it's it's not inviting anything.
Right, exactly.
I can be in this room and I don't have to apologize. And I just wonder what the next generation is going to do after that, because I just feel like it's just been this great expansion, but it's just that approach. But we need to make sure that as we're opening these doors, that we're leaving them open and welcoming more people in.
Thank you. You're such seasoned professionals. If you look at your career path and imagine it's a movie or book, what title would it have and what genre would it be? Comedy, thriller, any dead bodies?
I thought about that, and I would call it, Tracy and I were talking earlier, I would call it serendipity, and I think it would be very much a comedy. And I say that because I love to laugh, and I think in the end, one gets there. It's just the path that you take, or excuse me, the path you end up on is so vastly different from what you expected. But as you look back on it, it all makes sense, and it was meant to be. And so that's what I would.
Oh, mine would be The Amazing Adventures of.
Oh, I love that.
40 episodes.
Oh my gosh. I believe it would be heartfelt, not a thriller. Dead bodies, who's to say? But yeah, I think it would be The Amazing Adventures. There have been twists and turns in my career that were not anticipated. They were not planned and thought out. That just happened. And as a result of that, many opportunities have opened up that I'm truly grateful for.
Thank you.
Yeah. So as a true Latina, it would be a telenovela
I love this.
that has drama and emotion and laughter. Yeah, it's been. I mean, my life has been a great journey. My career is my life, so I can't separate either one. So that's why they would go together that way.
I'll steal an existing movie title, but not necessarily to match the movie to match my experience, but Everything Everywhere All at Once. I mean, I just feel like I'm operating on multiple dimensions.
That's so true.
There's comedy. There's definitely martial arts. I did martial arts for 20 years, so I got that. And sometimes you gotta kick a little bit.
So
to make
there's
it
certainly
in.
dead bodies there.
Some bruised. We'll have to check their pulse and find out. But
Unapologetically.
exactly. But yeah, it's just been. I mean, just having all channels open to possibility. And I had no idea I'd even go into healthcare, and I am in healthcare, and it's just been a phenomenal experience.
Thank you. There's one particular show that I loved watching, and there's one episode. It's basically 2-3 minutes that I rewatched probably 20 times, and we will watch it with you right now.
My kids, I promise their names will come to me. I think it's inevitable that they will hate me when they grow up. Like every other parent, I spend sleepless nights imagining what my kids are going to say about me to their psychiatrists. Right? You've done this. She wasn't home. She missed my baseball game. She made me listen to her tight 10 for a week before she opened in Toledo, and then had us heckle her for 3 hours so she had some practiced comebacks. And our drinks were watered down. That's why I need to get really famous. If you're really famous, everybody loves you. At least until the will is read. I heard a story about Mary Martin, Broadway star. Her driver got sick, so she had to take a cab to the theater she was performing at. She gets in, cabbie asks her where she's going. She has no idea. No idea where the theater is or what it's called. She is too famous to know. She is so famous that eventually someone will notice she's missing and just come find her. All she has to do is stand still. That's the kind of fame I want. Where I never have to know who I am or where I'm going. Where one day Bob Hope walks up to me at a restaurant and says, "Hi, I'm Bob Hope. You probably don't remember meeting me." And I say, "Of course I do. I'll have the chicken." I want a big life. I want to experience everything. I want to break every single rule there is. They say ambition is an unattractive trait in a woman. Maybe. But you know what's really unattractive? Waiting around for something to happen. Staring out a window thinking the life you should be living is out there somewhere, but not being willing to open the door and go get it, even if someone tells you you can't. Being a coward is only cute in The Wizard of Oz. Ethan and Esther. I knew it would come to me eventually. Oh.
fun one. What's your go-to, I need to feel like I have my life together move? Maybe a coffee, a dance, playlist, a new haircut. What are your tips?
I go spinning.
Spinning? Peloton?
Yes. Or class. It's that energy that sort of
Keeps the blood boiling.
yeah, I feel like I have control of something if it's only about
50.
I have a playlist. It's got Parliament, Stevie Wonder, some Queen.
Queen O.
It's yes, absolutely, and it is my go-to pump myself up montage reel moment. Absolutely. Actually, I made it in advance of whenever my funeral is because I want I'm like to have this as I think if and Louise, everything is planned in. I just want to have a good time, and so but I made the playlist. I was like, this is a really playlist. So that's my go-to.
Worship and walking. So I go for a walk. I play my music as loud as my noise canceling earphones will accept, and I sing as I walk through my neighborhood, and I don't care what anyone says while I'm singing and walking.
I love it.
And then retail therapy helps a lot.
Oh, yes. That's interesting.
A lot.
I tried that's good. I mean, it's still not right. I'm an instructor, and I become, depending on what music we're playing, it's sexy, is it loud, is it energetic? You know, it's kind of, if you want, you have to kind of demonstrate that for people to get it, you know, to feel it. And that's what I love about it. What makes me, recharge is it's not so much my physical, but it's a reaction of mostly women that attend those classes. You know, it's like for 1 hour, you're recharged, you are who you are without, if you can't dance, you're going left, everybody's going right, nobody cares.
Thank you. Thank you for sharing that, and thank you for coming over today. And I think so much left untold still. So I think we owe dinner. We need to meet
love
and
it.
have a dinner.
Wonderful.
And talk more about that.
Wonderful.
Thank you very much. And I hope everyone had a pleasure. We have time for questions? Perfect. I have one question that I saw is what men can do for women to support them?
I think just be like I mentioned, my brothers being supportive and saying, yeah, you want to be an astronaut? I'll buy you a telescope. That's what my brother did when I was, in high school. He's like, what are you going to do? I want to be an astronaut. So in his first job, he bought me a telescope. So
That's wonderful.
Just being there.
I think, as I mentioned in that meeting, it's that sort of understand the dynamics and then support the women if for some reason they can, and not make the women's perspectives necessarily wrong by definition.
How can I help you instead of good luck with that? Right? How can I help you instead of good luck with that? It's a
Very
game
simple
changer.
question. Yes.
Very big game changer. And make space. It requires self-awareness to know how much space you take in a room and to calibrate against others.
Who's inspiring you? This is also one of the questions from our employees. Who's inspiring you?
Gosh, I think my grandmother was the most amazing human being in the world. I have lovely, amazing parents, but my grandmother embodied resilience. She taught me to dream. There was no dream to what your brothers did for you that I couldn't accomplish. She even told me one time I was planning a trip to Europe, and she said, Tracy, you're dreaming of things that I never even thought of. And the thing is, yes, it touches your heart, but that she made space for me to be able to dream like that. That's inspiring. That is who I hear, and when the moments feel a little bit dark and difficult.
It's so lovely to hear because I think your nephews and your nieces many years later will say, we had the best aunt.
Yes.
Oh my God, she inspired us so much. I know that for sure.
Oh, thank you for that. I'll tell you, the 7-year-old said to me, because I said, Bud, you're being a jerk. He was, one of those long tantrums that went from the walk to the car to the house, and I was over it. And I put him to bed, and he came back and he said, "God, mommy, I'm really sorry for being a jerk."
Oh,
And it was just because what I try to instill in them is a jerk is a jerk. A jerk in a wheelchair, a jerk that's an Olympian. If you don't have character, integrity, honesty,
Mhm.
faithfulness, love to the question about what can a man do to support you, just be who you are. Just be as authentic as you are. And to your point, Louise, not only what can I do to help you, don't solve the problem. Just listen for a second.
Thank you.
Yeah, the same thing with my mother. Even though she's gone, it's still someone I look at, and the other women in my life, my mother-in-law, and those strong women, even some friends, just having their resiliency, what they've gone through, and they're still, surviving. Those are always examples for me to continue looking at.
Thank you. Thank you for sharing. Thank you for being vulnerable today. Thank you. We're good? Okay. Thank you very much for watching us. And the recording will be available in some time. Thank you.
Thank you. Really
Thank you so
appreciate it.
much.
This has been great.